My name is Megan Morton, and this is my healthcare policy issue presentation. The purpose of this presentation is to discuss the Stop Nurse Shortage Act that was introduced into legislation on October 18th, 2022. As a nurse working in healthcare, this legislation impacts my personal nursing practice. In this presentation, we will discuss the information regarding this legislation that has been introduced. The scope of this problem will be analyzed. Benefits of expanding educational programs for nurses will be discussed, as well as the economic, political, social, and ethical impact that the nursing shortage can have. Qualitative and quantitative data is important for reviewing statistical facts. My personal views regarding this bill and healthcare issue will also be mentioned before concluding the presentation. The Stop Nurse Shortage Act, as mentioned, was introduced on October 18th, 2022 to the House of Energy and Commerce. This bipartisan bill addresses the national nursing shortage by providing a $10 million per year grant to help nursing schools create or expand or support their accelerated nursing degree program. The goal is to increase the number of graduating nurses, including graduates from disadvantaged backgrounds. This bill aims to create, expand, or support the accelerated degree programs by hiring or retaining faculty and preceptors, increasing the number of clinical training sites, and offer more student financial assistance. By implementing this legislation, people interested in the nursing profession will have access to high quality education and training programs. Nursing shortages have been seen throughout history. The first nursing shortage was seen during the Great Depression in the 1930s. Nurses being used in World War II took away from the nurses in the community. There was a study conducted in 1947 by the U.S. Department of Labor that showed poor working conditions, low salaries, and long hours that were the cause of the shortage. Registered nurses make up a large portion of the nursing profession. Nurses are responsible for assuring high-quality, safe care for patients. Nursing shortages occur when the demand for nurses exceeds the number of nurses employed. Unfortunately, nursing shortages are still being seen today nationwide. The U.S. Bureau of Labor and Statistics projects 194,500 average annual openings for registered nurses between 2021 and 2031. It is important to note that any challenge in nursing can affect the health of the American people. Baby boomer nurses born between 1946 and 1964 will be reaching retirement age, which also contributes to the nursing shortage. In 1947, the solutions that were created in response to the nursing shortage was to shorten the length of training to create more nurses and increase the enrollment in nursing school. These are very similar solutions that are being introduced by the Stop Nurse Shortage Act. And the baby boomer era not only affects the number of nurses, but the volume of patients being seen in healthcare as well. As baby boomers age and retire, the need for healthcare will increase, putting a further strain on the nursing shortage. It is estimated that there are 78 million baby boomers that will age and be on the Medicare programs. Many of these people will suffer from multiple chronic diseases, which will increase nursing demand and influence the complexity of required nursing care. There are benefits to expanding the nursing degree program. Accelerated baccalaureate nursing programs are the quickest way to RN licensure for students who have already completed a bachelor's degree or graduate degree in a non-nursing discipline. Students can complete their bachelor's degree in nursing in 2 years and be eligible to sit for the NCLEX exam. In 2021, nursing schools in the United States turned away 91,938 qualified nursing applicants from baccalaureate and graduate nursing programs due to lack of faculty, clinical sites, and preceptors, and budget restrictions. Nursing students that fail classes or drop out of a program puts a strain on the financial investment of the school and the limited academic resources. Increasing funding towards nursing programs could help develop admission policies that could help filter out applicants that may have a lower success rate. Nursing programs also aim to increase diversity in the workforce. However, the nursing profession is 83% dominated by whites in comparison to other ethnic and racial groups. Women also dominate 90% of the nursing workforce. Ideally, the nursing workforce strives to mirror the diversity of the population they serve. Nursing education programs attempt to seek out gender, racial, and ethnic diversity in the student population. There are ethical and social impacts of nursing shortages. The ethical impacts on short staffing in healthcare puts nurses in ethical dilemmas when they are put in unsafe situations that could jeopardize their license. Nursing is a caring profession, and overall, nurses want to do what is best for their patients. Hospitals have an ethical obligation to improve patient outcomes. Inadequate staffing puts patients at risk when their needs cannot be met. It can be an ethical struggle when nurses are unable to perform the type of nursing care their Christian values guide them to. Non-malefiance is an obligation to do no harm. It is included in the Code of Ethics for Nursing. In the Bible, Luke chapter 6, verse 31 says, "And as you wish that others would do to you, do so to them," reminds us of how nursing care should be. There are also many social impacts of the nursing shortages. Social considerations include income, social support, access to health care, health knowledge, and poverty. Poverty can affect healthcare because poor living conditions can affect a person's health and ability to heal. Lack of access to healthcare or health insurance can prevent people from seeking preventative care. Often when they are seen in the hospital setting, they are very ill from lack of healthcare and health insurance. Health knowledge affects behaviors related to illness and disease. In the Bible, Proverbs chapter 31, verse 9 states, "Speak up and judge fairly, defend the rights of the poor and needy." There are also economic and political impacts of the nursing shortage. With economic impacts, these are seen in adverse events in healthcare. These events can have costly repercussions, and many could have been prevented if staffing had been adequate. An adverse event increases hospital length of stay. There is strong research regarding the economic consequences of adverse patient outcomes from hospital understaffing. A study was conducted on the economic costs that adverse events cause. It is estimated that $91.3 million annually could be spent on avoidable adverse patient events. These numbers should be shocking to legislation. There also is political impacts of nursing shortage. Federal and state policies impact funding that's received from federal and state legislation and can have a direct impact on nursing education programs. In politics, we should remember that we are all guided by God. In Romans chapter 13, verse 1, it says, "Every person is to be in subjection by the governing authorities, for there is no authority except from God, and those which exist are established by God." This coincides with my biblical worldview that God is the source of all truth, power, and authority. Statistical analysis and descriptive findings help to justify the nursing shortage problem. This data shows that the nurse shortage is a persistent problem that must be addressed at the federal level. According to Shelley and Miller, a national study done by the American Nurses Association that included 7,300 nurse respondents, 75% of nurses have felt the quality of nursing care has declined in their work setting in the last 2 years. 56% feel that their time for direct patient care has decreased. The National Conference of State Legislators reported that according to the U.S. Bureau of Labor and Statistics, 195,000 nursing vacancies will occur each year for the next 10 years. Another survey reported that 1/3 of nurses have thought about leaving their job by the end of 2022. The structural part of the National Database of Nursing Quality Indicators looks at the available nursing staff skill level and education. My personal views regarding this issue are in favor of the grant being given to the nursing schools. The expansion and creation of baccalaureate and graduate nursing programs can only help to recruit more people into the nursing profession. Evidence has shown that BSN educated nurses also promote positive patient outcomes from their advanced degree. It is unfortunate that currently there are people on waiting lists for nursing programs or have been denied altogether due to lack of faculty in clinical sites. Nursing degree programs would benefit from federal funding to expand their programs. By improving staff ratios, improved job satisfaction will occur among current employees, leading to a decrease in nursing turnover. Hospitals will benefit from adequate staffing. As a nurse working in the hospital setting, I have directly felt the burden of staffing shortages. If we do not find a solution for inadequate staffing, more nurses will continue to leave the nursing profession due to the stress and increased workload. Based on what I have found in research, the facts are overwhelming that nurse staffing is a huge problem. If we do not act on this problem now, we will be in a dilemma in several years when the patient population is expected to grow exponentially. Healthcare must continue to pray that the best is yet to come, for nothing will be impossible with God. In conclusion, I hope that through this presentation, I have illustrated the impact that nursing shortages can have on quality patient care. I strongly believe that the Stop Nurse Shortages Act will benefit healthcare and provide a strong future for nurses entering the medical field. As nurses, we are the backbone of healthcare. Nurses need assistance in providing safe, quality nursing care that the American people deserve. Please consider my research and views regarding this issue when voting for this issue in legislation.